Hello! In this session, we'll be talking about searching and critical analysis of evidence-based literature. Your first place to start in your research at the Dayton Memorial Library at Regis University is through our library website. The URL you see listed in front of you is for the Nursing Research Guide, and that provides you access to particular resources all involved in nursing research. Please be sure to take some time to bookmark this website in your favorite browser so that you can quickly access all of the materials that we have available to you. So starting out, what is evidence-based practice? So you're learning about this in your course, and to summarize, evidence-based practice is the use of the best scientific evidence integrated with clinical experience and incorporating patient values and preferences in the practice of professional nursing care. There are 5 steps when we're considering evidence-based practice. The first step is to ask a question using the PICO tool, which you will be learning about in class. Searching the literature for the evidence, then critically appraising your results. From those results, deciding what action to take from your findings and apply them to your practice. Then after that, you're going to evaluate your new and amended practice. For this session, I'll be addressing the first 3 steps here because that's where the library is involved and it will be an important resource for you. When looking at the literature for the evidence, you're going to see different sorts of evidence hierarchy, which give you the level of evidence for certain types of studies. Your course may use the Melnick's evidence hierarchy, which is a well-established hierarchy for evidence-based practice, which details the types of studies that are covered from level 1 to 7. Your course may also use the Pollitt and Beck evidence hierarchy. It's very similar, but looks a little bit different, and just depends on what textbook and what your instructor requires you to use to review the evidence. There are also others out there as well that you might encounter in your research. The top level of evidence in most hierarchies is called a systematic review. The systematic review is a critical assessment and evaluation of all the research studies that address a particular clinical issue. So with a systematic review, what you will see in these studies is that they look at and review numerous clinical research studies to evaluate the best course of a treatment or any other sort of clinical issue. They're very comprehensive and very detailed, and they tend to be the type of study that most students want to find to answer their question. However, not every question that you may be researching has a systematic review developed because they're very time-consuming and take a team of researchers to put together. So just because you don't find a systematic review when doing your library research, that's not necessarily a bad thing. It just might mean your particular topic has a level of evidence that might be a little lower than a systematic review. For example, a randomized controlled trial might be your top level of evidence. To find these sorts of studies, at Regis University, we have several databases where you will focus your attention to look for the evidence. We have the Cochrane Library, which includes the Cochrane Database of Systematic Reviews and the central database, or the Central Trials database. We have Medline and PubMed, which are very similar. Medline is the version of this database that you would use through our EBSCOhost services, while PubMed is the publicly available version available through the National Library of Medicine. The CINAHL database, which stands for the Cumulative Index to Nursing and Allied Health, would be another database that you would use, and that is also available through our EBSCOhost service. A couple other ones that you may look at would be our UpToDate and Dynamed Plus resources that are point of care resources that are also backed by evidence-based literature. And we have another one we subscribe to called Trip Pro that reveals systematic reviews as part of that database. All of these databases are available to you through the Nursing Research Guide under the Evidence-Based Practice tab that you see on the left. And they're also available throughout the library website through the A to Z database list, on the front of the Nursing Research Guide. There are various points where you can gain access to the numerous databases we have through the library. I'll stop here and ask you to continue on to the next video where we'll talk about developing your PICO question and searching the literature.